Hello everyone and welcome back to my channel. If this is your first time here, my name is Uchenna and I'm a chemotherapy nurse. On this channel, we talk about cancer treatment, chemotherapy side effects, nursing and practical information to help patients and the families understand the cancer journey. So today we'll be talking about 10 foods to limit or avoid whilst having chemotherapy. This topic is particularly important for patients and their families because they are concerned about what to eat while undergoing chemotherapy and what advice to trust. One important thing you need to know is that not every patient receiving chemotherapy should avoid these foods. Your chemotherapy regimen, your blood count, your side effects, and your general health would affect what is suitable for you. So let's get into this. Number one is grapefruit. Grapefruit can interact with some certain medicines in the body, including chemotherapy, and this may affect how it works or how it's been absorbed. So always confirm with your doctor, your oncology team, or your pharmacist about your particular treatment and if it's safe for you to take grapefruit. And then number two is alcohol. Alcohol may worsen some treatment side effects, and also it may irritate a sore mouth or a sore throat. Alcohol may also affect your liver enzymes. That's one of the test results that is being checked before every chemotherapy. So the advice is to limit or avoid alcohol completely, especially if you're treating liver-related cancers. Number three is sugary foods and drinks. There's a general misconception that cancer feeds on sugar. So cancer patients must completely avoid taking sugar. That's not accurate. Your body needs sugar for energy. So taking sugar does not directly make cancer cells to grow. However, large amounts of sugary drinks, sweets, or highly processed foods contain large amounts of calories and relatively little nutritional value. So during chemotherapy, the priority is getting enough nutrients, enough fluids, enough calories, and enough protein, especially if appetite is poor or your weight is reducing. Also, if your steroids or your chemotherapy is increasing your blood glucose, then definitely you will need to consider reducing sugar in your foods and your drinks. Now let's move to number four. But before we do that, I would like to appeal that if you're yet to subscribe to this channel, kindly do so by clicking on the subscribe button and also like, comment, and share this video to other people that would need this information. Now, number four is try to avoid or limit very hot or spicy foods, especially if you've got side effects from chemotherapy like nausea, like digestive problems, diarrhea or constipation, or you've got sore throat or heartburn. You may consider reducing or avoiding spicy foods. Number five is unwashed fruits or vegetables. Because a patient taking chemotherapy can have reduced immune system or compromised immune system, it's important to wash all your fruits and all your vegetables before eating them. Especially when you see visitors coming in and trying to offer you fruits from the fields or vegetables, always wash them before you consume that fruit. Number six is caffeinated drinks or beverages. You don't necessarily have to stop taking caffeinated drinks while having chemotherapy. But if you're suffering from reduced sleep or lack of sleep, heartburn, diarrhea, or nausea, you may consider reducing caffeinated drinks like the energy drinks, like cola, like coffee, or strong tea. Number seven is undercooked eggs or egg products. Raw eggs, such as some homemade mayonnaise or desserts, can compromise your immune system. So it is generally safe and advisable to eat properly cooked eggs or pasteurized egg products where appropriate. Number eight is supplements and herbal remedies. So people sometimes think that because something is labeled natural makes it safe to take during chemotherapy. Unfortunately, that's not always the case. Some supplements or herbal medicines can potentially affect how chemotherapy drugs are absorbed, metabolized, or how they work. Some may even increase bleeding risk or affect the liver. Examples, we've got the high dose antioxidants, some concentrated herbal medicines, and St. John's wort. That doesn't mean that every vitamin or supplement affects the body negatively. If a patient has a deficiency or the oncology team recommends a supplement, then it is appropriate. Number nine is raw fish or shell fish, like the oysters, the sushi, or other raw seafoods. The concern here is the transmission of foodborne infections. And number 10 is unpasteurized juice, milk, or dairy products. They can potentially contain harmful microorganisms, especially in chemotherapy patients where the immune system may be compromised. The advice here is to choose pasteurized milk or dairy products instead. And that is the end of our today's session about 10 foods to limit or avoid during chemotherapy. Don't forget, if you find this video helpful, kindly share to someone who may need this information. And if you're going through chemotherapy, kindly tell me what's the biggest challenge you found with food during your chemotherapy session. Until we see in our next video, stay safe and stay strong. Bye for now.